So hi friends, I'm Dr. Anshul Bansal, again joining you on this Unacademy platform. Okay, so first of all, am I audible to you? Because if I'm audible to you, please type something in the live chat box. Okay, sorry. So in today's YouTube live session, we'll discuss about the second part of the spinal column or the vertebral column section that we are covering. That is the PIVD, that is the prolapsed intervertebral disc. Okay, so this session is useful for the NEET PG 2022 aspirants. Okay, and also if you'll watch it shortly and jaldi, then it is very helpful for the FMG examination is due in this month only. Okay, so a very important prolapsed intervertebral disc or the disc herniation, etc., which is every now and then a question comes from this topic, so we'll cover this topic today. So currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. So before starting the session, I'll just briefly guide you about the various subscription plans that are available for the NEET PG on the Unacademy. The first one is your Plus subscription. The Plus subscribers will get access to all our live as well as recorded classes. They can access our entire QBank and they can compete in live tests and quizzes, all of which is found by the topmost faculty for the NEET PG in India. And for the and also we'll allow the subscribers to log into multiple devices with the same account so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we are shortly providing them with a printed notes. Sorry. So while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is your iconic subscription, and it is best not only on the Unacademy platform but across any digital platform for the NEET PG in India. And what makes this best is that apart from the things that I mentioned earlier, that is all the benefits of the Plus subscription will be there. In extra May, you'll get the prep ladder and all of the prep ladder, including its entire QBank, the video lectures, rapid revision courses, grand test, etc. And on Unacademy, you will get extra May well structured live batch wise classes, and we have formulated a batches and structured a course in such a way so as to build up your basic concept about any subject or topic first, then going into its in-depth. And also after every test you will give, the iconic subscribers will get an individual test assessment sheet so that you can analyze yourself ki yes, this topic or this subject needs more revision, or what are the things that I am missing, किस type के questions are being framed, what are the important topics that are repeated in questions. All of this are very important. And while subscribing for iconic subscription, you can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special because they'll give you extra edge over your competitors, and also you will get a live classroom like feeling in your sessions where you can interact with your educators in the live session. You can participate in polls, sorry, and you can solve your doubts and queries there and there in the live class only. And you can watch it anywhere, anytime. What you have to do, you have to just download the mobile application of Unacademy and log in using my code, that is Anshul B10. And very importantly, both of these are absolutely free. You don't have to pay any fees for attending this special class, and after every special class that you'll attend, you will also be given with the digital notes of that special class. Now, QBank is very effective. It contains every type of question that you need to practice. The QBank will cover your entire theory. It will cover your the questions which are previously asked in different examinations, the recall questions, the image based questions, questions based on X-rays, CTs, MRIs, pathology slides, and very importantly, the clinical case based questions, the various clinical scenarios. And it is very important to do the question practice because it is the best way to revise and very important for cracking any competitive examination. Also, we have launched a new feature called as raise a hand feature, and this feature is launched to make a digital platform more interactive, to increase the communication between learners and educators, so that you can solve your doubts there and there, discuss your queries with the educators in the live class only. These are the various subscription plans for Iconic as well as the Plus subscriptions, and here you can see that the cost per month decreases significantly if you increase the duration of your course. So economically it is very beneficial, and also academically you want to have a single source from the word go of your preparation, so that you don't want to or you don't have to hop around and study different topics or subjects from different source, because it will make your concept building and revision very difficult. So please, I would suggest to subscribe for any subscription package with longer duration, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. ओके, सो लेट्स स्टार्ट टुडेज सेशन. तो आज का सेशन स्टार्ट करने से पहले वील जस्ट क्विकली रिवाइज द थिंग्स दैट वी हैव स्टडीड अबाउट द वर्टिब्रल कॉलम इन द प्रीवियस लेक्चर, दैट इज अबाउट द वर्टिब्रल कॉलम की इंजरीज. तो सबसे पहले बेसिक एनाटॉमी में you have the vertebrae, 7 cervical vertebrae, 5 lumbar, उससे पहले 12 thoracic, also called as the dorsal, lumbar 5, sacrum 5 fused, and your coccyx 4 fused. Okay, now every vertebra has a common anatomy, that is the vertebral body and the vertebral arch. The vertebral arch consists of the transverse process, the spinous process, most posterior. Transverse process दो होते हैं, spinous process is single. Between a body and the transverse process you have the lamina, and between the transverse and the spinous process you have the pedicle. Now cervical vertebrae में क्या अलग होता है? First of all, the cervical vertebrae have a bifid spinous process. There is transverse foramina in each transverse process, from where the vertebral arteries run through. Okay, for the vertebral artery, and also the vertebral canal in which the spinal cord is there, it is the triangular. There is the canal is sorry, the canal is triangular. Okay, now the catch here is that C1, C2. C1 is called your atlas, C2 is your axis, and you can remember it by two things. सबसे पहले remember atlanto occipital joint. Okay, so occipit head joined with the atlas, atlanto-occipital joint, so atlas is C1. And second way you can remember is alphabetical order mein, if you'll see, T comes first, then X comes, so C1 is your atlas. And काम की बात is that the atlas or the C1 vertebra does not have the spinous process, so there is no spinous process in case of C1 or the atlas vertebra. Okay, now if you'll come about to the thoracic vertebra, in thoracic vertebra what you'll have, the normal cylindrical or the circular vertebral canal is there. In thoracic vertebra you have ribs ka articular surfaces to form the bony rib cage. Okay, so ribs ki head is attached to the superior and the inferior demi facets. Okay, if the rib is second rib, then the head of the second rib will articulate with the superior demi facet of the articulate with the inferior demi facet of the T1 and the superior demi facet of the T2. Okay, this is about the second rib. And second rib ka hi the tubercle wala part which connects the head with the neck or the shaft of the humerus, it articulates with the costal articular surface or the costal faces, and the second rib ka tubercle will articulate with the second T2, that is T2 costal facet only. So first difference is that or the characteristic feature is the facets for the articulation with the rib. Now the spinous process of thoracic vertebra are long and more posteriorly and inferiorly. Okay, long, posteriorly and inferiorly, these are the spinous process की characteristic feature. Now if you come to the lumbar vertebra, they again have the triangular canal, that is the vertebral foramina is triangular, and they are the largest vertebrae with large and more thick body, because they are the most important vertebra for the weight bearing. Okay, and the spinous process here, the spinous process is shorter, and that's why we do the lumbar puncture or the spinal anesthesia in the lumbar vertebra. Okay, these are the characteristic features of the normal vertebral column. Okay, iske baad there are certain type of fractures in the vertebra. You need to remember basically three fractures. The first fracture is your wedge compression fracture. इनको समझने के लिए you need to remember one thing. Okay, let's discuss that first. Okay, there are three columns of the vertebral column or any vertebra. Okay, the anterior column, the middle column, and the posterior column. Okay, so in anterior column, middle column and the posterior column, anterior column mein you have the anterior longitudinal ligament, posterior longitudinal ligament in the middle column, and the entire vertebral arch with the ligamentum flavum, the interspinous and the supraspinous ligaments all are in the posterior column. Whereas middle column mein so important thing that you should remember is that posterior longitudinal ligament is part of the middle column, not the posterior column. And here you have the anterior 1/3 of the disc and the body, and the posterior 1/3 of the disc and the body. So okay, these are the columns. Now in wedge compression fracture, what you will have, in wedge compression fracture, only one column may there will be fracture. Okay, the middle or the posterior column is not broken, whereas in the burst fracture you will have the anterior plus the middle column में fracture, posterior column में you will not have the fracture. They are the stable fractures. Okay, whereas chance fracture, the entire three columns, anterior, middle and the posterior column mein there is fracture, both are unstable and high chances of neurological deficit or the nerve compression. Okay, so three basic type of fractures you need to remember. इसके अलावा दो नाम वाले फ्रैक्चर यू नीड टू रिमेंबर. फर्स्ट इज योर जेफरसन फ्रैक्चर, which is fracture of C1 or atlas, and secondly you need to remember the clay Chevalier fracture, which is fracture of D1 or T1, that is first thoracic vertebra, and that too only the spinous process का fracture. This is your clay Chevalier fracture. Okay, and treatment we have discussed pedicle screw fixation, and if there is any nerve injury you have to do the decompression, and decompression is by the laminectomy. And posterior column injury plus the nature of the fracture or the morphology of the fracture, and thirdly the neurological deficit. ये three factors के basis पे you decide whether to do the surgery or not, and this is called as your Tillis grading. This is called as your Tillis grading. Okay, so remember this is important, and this was the basic things that you should remember about the last lecture. So now let us start today's lecture about the PIVD, that is prolapsed intervertebral disc. Okay, so intervertebral disc, as we have studied, came between two vertebral bodies. There is a cushion, a fibrocartilaginous disc, which is called as the intervertebral disc, and it has the basically three distinct parts: the cartilage and nucleus pulposus and annulus fibrosus. Important is these two. The cartilage plates are nothing but a thin layers of hyaline cartilage at the articulating surfaces of the vertebral body. The major part, important two parts जो आपको याद रखने हैं. First is your annulus fibrosus. Annulus fibrosus is a fibrous ring at the periphery of the vertebral disc, intervertebral disc. Okay, this is of concentric rings of fibrocartilaginous tissue, and इसके बीच में there is a jelly like substance which is called as the nucleus pulposus, which is remnant of the notochord. Nucleus pulposus is remnant of notochord. This is your nucleus pulposus. Okay, and at the back of the vertebral bodies, obviously there will be one ligament called as the posterior longitudinal ligament, as we have discussed. Okay, so this is your vertebral body, this is your vertebral arch. Okay, now vertebral body में you के ऊपर and नीचे you have the vertebral disc. Okay, and there you have the periphery में annulus fibrosus, and center में lying just posterior, this is your posterior, lying just posterior, this is your posterior, and this is your anterior, this is your nucleus pulposus. And vertebral arch में these are your transverse process, this is your spinous process, and इसके बीच में this is your pedicle, that is body and transverse process के बीच में, and transverse process and spinous process के बीच में you have this lamina. Okay, in the lateral view also, this is your spinous process, body, intervertebral disc. Okay, this we have already discussed: spinous process, transverse process, lamina, pedicle, the vertebral body. Okay, this is your anterior part, this is your posterior part. Vertebral arch में have the lamina, pedicle, transverse process, and your spinous process. This is your body. Okay, these are the facets. Okay, we have discussed. Now this is the important columns. Okay, so this is your anterior column, this is your middle column, and this is your posterior column. Two-third anterior, two-third of the vertebrae and the disc, posterior one-third of the vertebrae and the disc. This orange is your anterior longitudinal ligament, this purple is your posterior longitudinal ligament, this sky blue, it is your ligamentum flavum, the interspinous ligament, and the supraspinous ligament. So herniation or disc prolapse में obviously the importance will be of this posterior longitudinal ligament. It will prevent the disc to herniate into the posterior column, because posterior column में injury में if there is any disturbance in the posterior column, there are very high chances of nerve injury or nerve compression. Okay, remember this. That's why the posterior column is very important. And आपके काम के लिए you need to remember one more thing, that posterior longitudinal ligament is not the part of the posterior ligament complex or the posterior column, it is part of the middle column. Okay, this is your Dennis classification. The anterior column we have already discussed सब कुछ, middle column में भी we have already discussed everything, and posterior column we have already discussed everything about the posterior column also. Okay, now pathology. What happens is that in case of prolapsed disc, नाम से पता चल रहा है, the disc will be prolapsed, and this prolapsed disc or the herniation, it will be on the posterior aspect. Okay, that is towards the posterior longitudinal ligament, then the vertebral arch. Okay, now it is a phenomena which start from a long time, and when this disc become weak, then there is protrusion. So isme the first thing that occurs is your degeneration, that is nuclear degeneration. There is degenerative changes much before. First of all, there is degenerative changes in the annulus fibrosis, okay, then the nucleus. Okay, so nucleus degeneration mein there will be more softening and fragmentation of this nucleus pulposus, and at the posterior part of the annulus there will be starting of the disintegration, from which there will be prolapse of the nucleus pulposus. So nucleus displacement due to pressure. First of all, only when annulus is weak, the nucleus will just protrude out or bulge through the defect. Okay, only this bulging of the nucleus pulposus through the annulus fibrosis defect, this is called as disc protrusion. Whereas after this, the next stage will come, whereas the annulus fibrosis will break and there will be spilling out of the nucleus pulposus, but still it has not lost the contact. The nucleus pulposus has not lost the contact with the disc, and the spilled out nucleus pulposus has not crossed the posterior longitudinal ligament, that is still under the posterior longitudinal ligament. This is called as your disc extrusion. And after, once there is extrusion of the disc will not go back. ये important है, ये ध्यान रखना है. Protruded disc can go back, but extruded disc cannot go back. Okay, now this extruded disc, if it loses its contact with the remaining disc, and it traverse across the posterior longitudinal ligament, then it is called as your sequestered disc. Okay, so सबसे पहले there will be protrusion, then there will be extrusion, then there will be sequestration, because this posterior longitudinal ligament is not so strong. Okay, now degeneration of the disc, only the bulging of the disc or the herniation. Herniation is equivalent to the extrusion. Herniation is equivalent to the extrusion and bulging is protrusion. Okay, ये तो हो गया बहुत डीप में कि प्रोट्रूजन इज बल्जिंग, एक्सट्रूजन इज हर्निएशन. लेकिन इफ द question comes like prolapsed intervertebral disc or herniated disc, okay, then you have to consider it all as the same. Okay, now this is your normal disc. There is only degeneration starting, leading to this bulging, which is called as the prolapse. And when there is spilling of the nucleus pulposus but within the posterior longitudinal ligament, this is called as your extrusion. And crossing the posterior ligament, losing its contact with the parent disc, this is called as your sequestration. Okay, this yellow color is your annulus fibrosis, and this pink color part, it is your nucleus pulposus. This pink color part, it is your nucleus pulposus. Okay, remember this. Okay, now first stage हो गई. First stage was your stage of nuclear degeneration or degeneration of the vertebral intervertebral disc. After degeneration, there will be displacement of the nucleus, and lastly, as in any other disease, it will be the stage of fibrosis or the stage of repair. Okay, so degeneration ke alongside there is a starting of the fibrosis. Okay, so the nucleus pulposus is jelly like, it will become hard and fibrosed, and the extruded part of this nucleus pulposus will be flattened and fibrosed and may undergo calcification, and this may impinge the nerve roots. Okay, so and also where there is posterior longitudinal ligament may, if there is any injury by the crossing, usme bhi healing and the new bone formation is start, and there is spur formation obviously. Okay, and most common dislocation is your, or the prolapse of the intervertebral disc is the posterior, we have already discussed, and posterior may be the posterior lateral, it is the most common. And second most common is a posterior, that is midline posterior or the central, it is the second most common type of disc prolapse. Okay, now there is another type which is called as the dissecting extrusion, yani there is extrusion of the disc, the nucleus pulposus is crossed posteriorly to the posterior longitudinal ligament. Okay, and but sometimes what happens is it is so intense that it strips off, or there is some avulsion of the posterior longitudinal ligament, and this is called as your dissecting extrusion, that is it is dissecting something, that is dissecting the posterior longitudinal ligament. The most common is your lumbar vertebra, and that too L4 L5 is the most common, and in case of cervical vertebra C5 C6 is the most common. Remember this, this is asked, this has been asked like twice or thrice. Okay, so L4 L5 lumbar में overall most common, and specifically cervical के लिए पूछे then it is C5 C6. Okay, now intervertebral disc herniation we have already discussed कि it is a form of extrusion. Okay, so disc is fibrocartilaginous, and the function is first of all flexibility and the shock absorbers, and also in the lumbar and the thoracic vertebra they are wedge shaped due to the support of the curvature of the spine. Okay, annulus fibrosis, nucleus pulposus, most commonly in the posterior lateral direction, we have discussed this all. Now after degeneration, the displacement and the fibrosis, now there will be secondary changes, and secondary changes will be in the nerve root or the spinal cord only. Okay, so these can be space occupying lesions in the spinal canal. So if there is unilateral protrusion and these are the extrathecal core, so there will be impingement. So here only a single nerve root will be affected. Now very important is to identify the nerve root. See, if for example, how will you identify ki which nerve root is affected by the PIVD? Then you will test the respective myotomes which are supplied by the respective nerve roots, which we will discuss. Suppose there is, you are suspecting L5, so L5 को diagnose करने के लिए, if L5 is working properly, then there will be extension of the grade 2. But if it is absent, or at the time of extension of the grade 2 there is tingling and other sensations, then L5 is affected. So अब अगर L5 affected हुई है, so what will be the level of prolapse or the injury, L4 L5 or L5 S1? Okay, you have to decide between these two options. Then remember हमेशा कि the injury is of the lower level, that is if L5 is injured, then the prolapse will be at the L4 L5 level, not at the L5 S1 level, because L5 S1 level पे क्या होगा, L5 nerve roots will traverse just above the prolapse wala part or the disc wala part, and uske niche the S1 are there, so obviously the compression will be of the lower roots. Okay, so in L5 S1 ke case pe compression will be of S1, whereas in L4 L5 the compression will be of the L5. Okay, because the nerve root affected leaves the spinal canal below the next vertebrae. Okay, so nerve root affected in disc prolapse between L4 L5 is L5. Okay, very important, remember this, is type के questions are very frequently there in the examination. Okay, myotomes abhi aage we'll discuss them. So there can also be pressure effects which are generally intrathecal. Okay, these can be the Cauda equina syndrome. Okay, Cauda equina syndrome or the conus medullaris syndrome, which we will study बाद में separately. So just initially what you should remember that after the level of L2 or lower end of the L1 के बाद से what happens is that spinal cord ends and there is cauda equina. So if there is injury to the intrathecal roots, any deep inside the spinal cord, then there will be cauda equina syndrome. So obviously cauda equina syndrome will be more severe than the normal PIVD, that is the normal disc protrusion or the extrusion. So normal disc protrusion or extrusion में the symptoms पहले अपन वो पढ़ेंगे, then we will differentiate them with the symptoms of the cauda equina. Okay. So सबसे पहले diagnosis there will be history of pain, etc., difficulty in walking, especially in the lower back area, and there might be unilateral tingling, numbness sensation in unilateral lower limb, and also there might be obesity, etc. Okay, and you do the CT, MRI, X-ray. The investigation of choice is your MRI. Okay, the investigation of choice is your MRI. And in clinical features, most commonly in the younger age group, that is 20 to 40 years of the age में होता है due to the sedentary lifestyle and obesity, etc. So there is lower back pain, and as we have discussed, unilateral radiating pain with numbness, tingling in a unilateral lower limb will be there starting from the buttocks, and this is called as your sciatica. Okay, this is called as your sciatica, which is very important. Just remember, sciatica pain will be there in the PIVD. Okay, there can be history of trauma, etc., or lifting of heavy object, etc. So lower back ache mein it will be severe and acute. Okay, and due to this there will be muscular spasm and there will be rigidity. Okay, so there will be muscular spasm and painful movement. Okay, and if it is chronic, there obviously it will be dull, not that severe. Okay, and it is relieved by rest, differentiating it with the pain of एंकाइलोजिंग स्पॉन्डिलाइटिस, जिसका कैरेक्टरिस्टिक फीचर इज दैट एंकाइलोजिंग स्पॉन्डिलाइटिस में द कैरेक्टरिस्टिक फीचर इज व्हाट, the pain is increased while resting and the pain decreases on work or movement. Okay, now second is your sciatica pain. लोअर बैक पेन के साथ जनरली इट इज एसोसिएटेड एंड कम्स आफ्टर द लोअर बैक पेन. Okay, but in some cases it might be the sole and the first presenting symptom. Okay, so pain radiates from the gluteal region to the back of the thigh and the leg. Okay, and the pattern of the pain or the radiation depends on the root which is compressed. Okay, कि S1 में कैसा होगा, L5 में कैसा होगा, so we will all see that in the myotomes wala part. So L5 में grade 2 extension with pain radiating to the anterolateral aspect of the leg and the ankle, whereas in S1 it will be posterolateral calf and the heel. So L5 में anterolateral side में and S1 में the pain will radiate to the posterior calf and the heel. Okay, and these are the myotomes. Okay, so myotomes that we were discussing कि how will you check कि which root is affected. So उसके लिए cervical injury के लिए you have C1, C2, C3, C4, C5 for the shoulder, C6, C7 for the elbow, C8 for the thumb extension. Okay, and T1 for the finger adduction. Okay, finger के लिए adduction T1 and thumb extension C8. Then L1, L2 is for the hip flexion, L3 is for the knee extension. So hip के लिए L1, L2, knee के लिए L3, L4, L5 is for the ankle, and ankle में भी क्या, the dorsiflexion, that is towards the shin. Ankle dorsiflexion very important is your L5 akela. L5 akela can be tested by the grade 2 extension. Okay, S1 एंकल का प्लांटर फ्लेक्शन पोस्टीरियर अपन ने देखा था, तो एंकल प्लांटर फ्लेक्शन and rest sacral roots for the bladder or the bowel and bladder motor supply. Okay, so C1 C2 C3 for the cervical, इसमें भी अगर deep में you can remember, then C1 for flexion, C2 for extension and C3 for the lateral flexion. C4 5 is for the shoulder elevation, and the abduction is for the C5. C6 C7 elbow first flexion, C6 extension, C7 L1 L2 for the hip joint, that to flexion, L3 for the knee extension, L4 L5 ankle ka dorsiflexion, L5 great toe extension, and S1 for the ankle ka plantar flexion. Okay, these are the myotomes. Now myotomes means muscle supplying, and the other part is your dermatomes. Okay, that we have seen the only the sensory or the skin supply. Okay, like the sural nerves, the lateral posterior cutaneous nerve of the thigh, okay, or saphenous nerve, all these are the dermatomes. Okay, that we have already studied in the nerve wala part. Okay, so these are the myotomes, and these are the symptoms of the normal PIVD. Okay, now if you examine any patient of a PIVD, that is protrusion, then posture सबसे पहले there will be muscle spasm, so the back will be rigid with flattened lumbar spine. Okay, and obviously to support this uh, disease part, there will be a tilt in the pelvis. Okay, there will be a tilt in the pelvis. Okay, and this is called as your sciatic tilt, and it will be a sideways tilt, so it is a scoliosis, and it is called as your postural or the non-structural scoliosis or the sciatic tilt. Okay, it is a postural or the non-structural. See, this is your scoliosis, also called as the sciatic tilt. Okay, scoliosis also called as the sciatic tilt. Okay, this is seen because there is weakness in one part of the pelvis due to the nerve compression, so the pelvis will try to tilt and compensate for this pathology. Okay, the patient will be unable to bend forwards due to muscular spasm. There will be tenderness in the lumbosacral region. Now there are two tests. First is your SLR or the straight leg raising test. Second is your LASIK test. So सबसे पहले SLR is asking the patient completely in the supine position to raise the leg actively without bending the knee. Okay, and active raise means कि patient खुद without any support will raise the leg. Okay, and this indicates the nerve root compression कि हिप में या फिर रेडिएटिंग पेन कहाँ किस लेवल पे स्टार्ट होता है, देन यू कैन आइडेंटिफाई. सो इफ द पेन इन द लोअर बैक एग्रीवेट्स आफ्टर 90 degrees. Okay, this is your 90 degrees. So after 90 degrees, if there is no pain in the leg, or the back pain exaggerates after the 90 degrees, then it is due to mechanical causes. Okay, there is no pain at or beyond 90 degrees in the leg, radiating pain नहीं होगा. This is due to mechanical causes, यानी PIVD वगैरह नहीं है. And if the pain is between 30 to 90 degrees, especially at the 45 degree, called as the Powell's pain, okay, then it is called as your neurogenic pain. Okay, for the nerve compression like PIVD etc. So between 30 to 90 degrees, especially Powell's pain at 45 degrees, then this is your neurogenic pain. Okay, and L2 L3 के लेवल पे ही if there is pain, then it is sorry at 0 डिग्री पे सुपाइन में या जरा सा ऊपर करते, then it is, और ऊपर L2 L3 के लेवल पे more chances of the Cauda equina syndrome. तो आपको दो बातें याद रखनी, above 90 and between 30 and 90 45 degree Powell's pain, which is the neurogenic pain. This is your straight leg raising test. Okay. Now LASIK test. LASIK test is done like this. Hip and knee are flexed at 90 degree in supine position, and then you gradually extend the knee like this. Okay, so if there is radiating pain in the thigh, then this is called as your positive test, which means there is some nerve root compression. There is some nerve root compression. Okay, so this was about the normal PIVD के signs and symptoms. Now in case of Cauda equina syndrome, these symptoms will be exaggerated or very intense. So उसमें क्या होगा? The nerve roots are compressed, that is intrathecal cutting of the sensation and the movement. So bowel bladder disturbances will be there. Most common symptom is your bowel, that is urinary retention. It is important. That is the most common symptom of Cauda equina, is your urinary retention. The pain will be sharp and the stabbing pain in the legs, and there will be very important after the bowel incontinence is your, sorry, bowel incontinence नहीं, bowel urinary retention. Okay, both are different. Incontinence means retention नहीं होगा, the person will not be able to control the urine. Okay, so there will be bowel retention. And second is your saddle anesthesia, a sharp stabbing pain and saddle anesthesia, yani in the entire saddle area there will be hypoesthesia, anesthesia. What is the saddle area? Saddle area is the perineum, involving the anus, the genitals and the buttock. And if it is there, obviously obviously, the treatment of Cauda equina is mostly surgical, where you have to decompress the nerve roots by the laminectomy, and lumbar region में है तो it is called as your lumbar laminectomy. Okay, now this is was your Cauda equina syndrome. किसी symptoms कितने ज़्यादा intense है? First of all, bowel involvement, sharp and stabbing pain, and the saddle anesthesia. Okay, now this is your MRI. Okay, MRI में which cut is this? Okay, it is cutting the cervical, sorry, the vertebral column like this. Okay, so this is your sag cut, that is your sagittal cut. Okay, here you can see this is your vertebral body, and uske beech mein there is your intervertebral disc here, and this is your nerve root, and yahan pe there is your spinous process and the entire posterior ligamental complex. This is your posterior ligamental complex. Okay, this is your anterior longitudinal ligament, this is your posterior longitudinal ligament. And वैसे you should start counting the vertebra from the topmost part. Okay, so the first spinous process that you'll see, that will be of the C2. So the counting starts from the C2, क्योंकि C1 में spinous process is absent, like we have said. नीचे से क्यों नहीं करते? Like we can already see say कि yes, ये sacrum यहाँ से start हो रही है fuse, तो this is your S1, so this is your L5, L4, yes, ये अभी तो सही आ रहा है, but due to sacralization or lumbarization, you may count the vertebral bodies wrong. Okay, that's why you should start from the top. Okay, so यहाँ पे you can see that the intervertebral disc is normal in all the vertebra, and in this image is this intervertebral disc. Here you can see that there is prolapse and the impingement of the nerve roots here. So this is PIVD, that is prolapsed intervertebral disc. Okay, so we have already discussed sab kuch. The degenerative disc, bulging, herniated. Bulging is protrusion, this is your extrusion. Thinning of the disc and osteophyte formation with disc degeneration in old age. Okay, now intervertebral disc prolapse, the pathophysiology is that with aging the vascular channels and the diffusion of the nutrients जो होता है, it is decreased inside the nucleus pulposus. So the nutrition of the nucleus pulposus and the viable chondrocytes decreases. So the proteoglycans and the proportion, or the proteoglycans are hydrophilic, so ज़्यादा से ज़्यादा nutrients and water they absorb and keeps this nucleus pulposus jelly like. So the proteoglycans decreases and the collagen wala part, which is more in annulus fibrosis already, it increases. So the water binding capacity decreases and the flexibility decreases, so there is stiffer nucleus pulposus and the stiffer intervertebral disc, which will lead to the prolapse. Okay, so this is the pathophysiology. Okay, the diagnosis, clinical features, we have discussed this all. Movements may unable to bend forwards, we have discussed, due to muscle spasm. Diffuse tenderness will be there, and the radiating pain if it walks on the beginning, especially in the posterior of the thigh and the calf, and relieved on the rest. Okay, it is somewhat like the intermittent claudication, जहाँ पे calf muscles में there is excruciating pain on walking, and it decreases on the rest. That was due to DVT, deep vein thrombosis, the intermittent claudication. If similar pain occurs after the backache and it is radiating one, increases on the work and decreases on the rest, then this is called as your neurological claudication. This is called as your neurological claudication. Okay, remember this. So neurological symptoms, there will be paresthesia like tingling, pins and needles to the dermatome, that we have already discussed in the nerve wala part. Okay, there will be weakness of the muscle and this PIVD, Cauda, equina, these are the element, that is the lower motor neuron type of paralysis. Okay, so there will be ankle jerks will be absent. There can be bowel and the urinary incontinence and the retention also. Okay, so this is the examination. Sciatic till LASIK test, SLR test, we have discussed this all. Okay, L5 के लिए grade 2 extension, that is your extensor hallucis longus muscle. Grade 2 extension we have already seen, it is the myotome of the L5. Okay, plain x-ray generally not conclusive, and you will find it almost normal. Myelography पहले करते थे, not done nowadays. इसमें you inject a dye and then you keep the do the serial x-rays, and if there is any cutoff you can see here, called as the root cutoff sign. Okay, this is your root cutoff sign. Okay, not done nowadays, इसलिए मैं अच्छे से I'm not wasting the time here, just you need to know that. CT scan and the MRI. The MRI is your investigation of choice. Okay, CT scan में you can see the changes, but obviously the soft tissues, the intervertebral disc or the posterior longitudinal ligament, etc., these will be more visualizable and easily अच्छे से दिखेंगे in the MRI. Electromyography can be done to assess the nerve weakness, कि किस nerve में weakness है. Okay, so this is the axial cut. Okay, and in this here you can see that this is your vertebral body, intervertebral disc here, and this is your posterior side, so this is your posterior longitudinal ligament. Okay, so this is the axial view. आपके एग्जाम में if you will get, most probably you will get the sag view, this one. So this we have already discussed: the vertebral body, the disc, the anterior posterior longitudinal ligament, the nerve roots, okay, and the posterior longitudinal complex, that is the spinous process, etc. So here you can see, here there is only bulging starting, and here there is extrusion also, which is compressing the nerve roots, okay. Extrusion also, which is compressing the nerve roots. Now we'll come to the Cauda equina and the conus medullaris, okay. So here you can see, at the level of L2, lower border of L1 and L2, the spinal cord, it becomes tethered like this, and only iske niche there is only a hair like structure, only a thread like structure till the end of the sacrum, okay. So this last part, this triangular, this is called as your conus medullaris, and iske niche there is these are called as the cauda equina, okay. Now till the level of this S2 or S3, this thread-like spinal cord is enclosed into the meninges, that is durameter, arachnoid and the pyometer, and iske baad even the meningeal covering is lost, okay. So यहाँ के बाद spinal cord is only thread like, that's why L4 L5 L3 L4 के बीच में you do the lumbar puncture, okay. यहाँ पे करोगे तो there will be high chances of injuring the spinal cord, okay. Now cauda equina L2 के नीचे, if there is extrusion या nerve root compression at a great level, that is intrathecal pressure effect की वजह से, then there will be cauda equina syndrome. and उससे पहले अगर intrathecal pressure effect की वजह से कुछ भी होगा, then at the level of conus medullaris, then it will be called as your conus medullaris syndrome. And the part of this thread like structure which is covered inside the meninges, it is called as the phylum terminal internum, and not covered by meninges, it is called as the phylum terminal externum. ठीक है. Now the differences between conus medullaris and the cauda equina. So ये याद रख लो, दिस कॉनस मेडुलरिस सिंड्रोम L1 L2 के लेवल पे होगा, ऊपर होगा, सो इट विल बी मोर इंटेंस एंड द साइंस एंड सिम्टम्स विल बी मोर इंटेंस, वेयरएज कॉडा इक्विना सिंड्रोम L2 से सेक्रम के बीच में होगा, ओके. सो the presentation of the conus medullaris, signs and symptoms हमेशा सबसे ज़्यादा होंगे. सो द प्रेजेंटेशन हियर, इट विल बी सडन, बायलेटरल, लोअर बैक पेन विल बी मोर, द मोटर स्ट्रेंथ बायलेटरल है तो इट विल बी सिमेट्रिकल, okay, and the ankle jerks will be affected, and there will be localized numbness in the perianal area, symmetrical as well as bilateral yani saddle anesthesia, and the urinary and the bowel bladder incontinence will be early, and there will be high chances, more chances of the impotency, okay. सिर्फ एक ही चीज है that is less severe in conus medullaris as compared to the cauda equina, it is the radicular pain, that is the sciatica like pain, okay. So लो बैक एक तो ज़्यादा होगा in conus medullaris, but the radicular or the sciatica like pain is less severe in conus medullaris, okay. So it will be, cauda equina will be gradual and unilateral, more severe radicular pain, less severe backache. Okay, asymmetrical paraplegia or areflexic paraplegia होगा, where here it will be hyperreflexic. Ankle jerks affected, both ankle and knee jerks affected, asymmetrical, late urinary and fecal incontinence, and impotency is less frequent. Okay, so differential diagnosis: low backache with sciatica like pain, so ankylosing spondylitis, vascular insufficiency, etc. So spinal tuberculosis में तो characteristic lesion will be absent, and the normal systemic signs and symptoms of the tuberculosis will be absent. And in case of ankylosing spondylitis, दो चीज आपको ध्यान रखनी है, दैट इज फर्स्ट इज योर HLA-B27. HLA-B27 पॉजिटिव होता है, कैरेक्टरिस्टिक पेन वी हैव ऑलरेडी डिस्कस्ड, एंड बैम्बू स्पाइन और द डैगर साइन मीन्स देयर इज फ्यूजन ऑफ दिस इंटरवर्टिब्रल जॉइंट, यानी देयर इज बोनी एनकाइलोसिस, मूवमेंट इज लेस, देयर इज स्टिफनेस. द फर्स्ट जॉइंट दैट इज इन्वॉल्व इज योर sacroiliac joint. The first joint that is involved with your sacroiliac joint, very important. And इसके अलावा जो दूसरी चीज़ें होती हैं, the test, okay, the pump handle test, the Ganslin's test, the Fleshy test, all these are important. And systemic signs and symptoms are also associated, like the reactive arthritis of the knee ankle joint, reactive urethritis, reactive iritis, iridocyclitis, all these. So ankylosing spondylitis, very important for examination. This year also 3 questions in the NEET PG were from the ankylosing spondylitis. Okay, so the treatment जो होता है, first of all you need to remember that it is a chronic disease, so there will be acute exacerbations, then you have to take the rest and etc, and take the medicines, then there will be time of remission, then there will be again acute exacerbations on doing some heavy lifting wala work या excessive exercise etc. So conservative treatment is okay till if there is only sciatica like pain. If there is Cauda equina or the conus medullaris, or if there is urinary or bowel incontinence, or if there is complete weakness of the muscles, then you have to go for the nerve decompression. Okay, so conservative management, most important is your rest, that too hard bed rest. Drugs comprising of the NSAIDs, muscle relaxant, that is chlorzoxazone etc. And then there will be your methylcobalamin and pregabalin or amitriptyline etc. for the neurogenic pain. The physiotherapy, the hot fomentation or the general exercises, traction or TENS, newer transcutaneous electric nerve stimulation etc. For the operative intervention, if there is failure of the conservative treatment, Cauda equina or the conus medullary syndrome, or if there is severe sciatic tilt, so you have to decompress the compressed nerve root in surgery. So decompression के लिए you have to remove certain part, so it can be done. So most common you done the laminectomy. In laminectomy, as we have discussed, the part between the transverse and the spinous process is called as the lamina. Okay, and you completely remove this lamina so that there is decompression. Okay, now in fenestration, lamina से just attached होता है the ligamentum flavum. So ligamentum flavum is excised. In laminotomy, ligamentum flavum के साथ में you also make hole, just hole. Tomy means just hole in the lamina. Hemilaminectomy एक side का, laminectomy that we do it is of the both sides. So अगर treatment of choice पूछे तो it is the laminectomy. Okay. अनादर सिर्फ एग्जामिनेशन पॉइंट ऑफ व्यू से इम्पॉर्टेंट है जो कीमोन्यूक्लियोसिस, इसके अंदर वी पुट एन एंजाइम दैट इज कॉल्ड एज काइमोपेपेन. ओके, एंड दिस काइमोपेपेन एंजाइम नाम से पता चल रहा है इट डिजोल्व्स द फाइब्रस एंड द कार्टिलेजिनस टिश्यू आफ्टर द स्टेज ऑफ फाइब्रोसिस व्हिच इज इम्पिंचिंग द नर्व रूट्स. इट इज कॉल्ड एज द chemonucleosis. And newer, more acha is your percutaneous discectomy. If the symptoms are very large, using an endoscope or the percutaneous method, you can just remove the disc. Okay, and disc remove कर दी तो उनके बीच में you put an artificial ring like of structure which is called as the cage, which works as the intervertebral disc. Okay, now cervical disc prolapse, signs and symptoms will be same: cervical stiffness, neck stiffness, pain, and here the sciatica like pain nahi hoga. यहाँ पे the radiating pain, numbness, tingling will be in the upper arm as per the myotomes that we have discussed. Most commonly it is the C5 C6. Same posterior lateral protrusion is the commonest. Symptoms we have discussed, and the management is same. Okay, MRI is the treatment of choice, management is the same. Okay, so this was, I guess this was all about the entire PIVD, that is the prolapsed intervertebral disc. I hope you remembered sab अच्छे से and you made your concepts. If you have any doubt regarding this, you can ask me in the live chat box abhi. Okay. If you like my video, please like, share and subscribe, and watch my other videos on the YouTube as well as the special classes. And you can use my code while subscribing for any of the subscription packages and you will get extra 10% off. Okay, now tomorrow vertebral column को आगे बढ़ाते हुए, the next class is of the spine deformities tomorrow evening on the YouTube. Okay, at around 4:30 p.m. I guess it is. Okay, and spine deformities pe, where we'll study about the scoliosis, kyphosis majorly, and a quick and we'll also do a quick review